Hi, I'm Dr. Rajani. Thanks for joining me today. I often get asked, what do I do at the first signs of facial aging? What should my program be? What would it look like? Today I'm going to tell you 3 signs that you can look for in your skin to know you're at the early stages, and 3 things you can do at that stage to prevent facial aging, to build your collagen and look your best. So you need less services. So you don't need Botox, you don't need fillers, you don't need a facelift or surgical intervention. There are things you can do. The way to find out, first you have to go, well, am I at the first stage of facial aging? And there's 3 ways to tell. The first one that people notice is they look better 1 hour after they get up. So the youth, they just look great all the time. The skin looks great, it's hydrated, they wake up in the morning, wake up, no makeup. They're cruising, they got it. If you notice all of a sudden, after a half hour, an hour, you're looking a lot better, that's the first sign of facial aging. Number 2 is when you move a muscle. When you move something in your face, when you move your skin, if you pinch it together and a line stays, a line is ingrained in the skin. That's a late first sign, but it's one of the first signs. Often the crow's feet will show it. There'll be a line that just kind of stays. Maybe it's in the forehead. That's an early sign when you have the first 1 or 2 of those. Vertical lip lines, late sign. So the third one would be sag, when you're seeing a minor degree of sag, just a little bit at the edge of the mouth, the upper eyelid. Those are some of the first places that people see it because it bothers them the most. Sometimes I'd say nasolabial fold, but people have them at a young age and they become obsessed early. It doesn't necessarily indicate sag. Mentally, people feel like these are aging when in fact they're not. So that's a hard gauge. But those are 3 signs to let you know. Now, if you like the videos, please click the like button, subscribe, and follow me here for continued tips. What are the 3 things that you should be doing to not just prevent, because I'm going to leave prevention, it's a whole nother video. I have a lot of videos on aging rate, diet, exercise, prevention, but what are the 3, I'll put in treatment categories that you should be doing when you see those signs. The first thing to do is a retinol. Retinoic acid, vitamin A derivatives, people know retinols, retinaldehyde, retinoics. Those are the 3. I did a complete video, I'll put a link to retinols and the complete tutorial to retinols. That's a good one to watch. But why would you do that? Because they help build collagen, they thicken the dermis, they help with sunspots, they increase glow. And in my practice, what I noticed over 25 years, people who are on them just look younger. And you're seeing people now question a little bit about them. But if you look in clinical practice, people come in, they look great. There's certain common denominators. One of them is being on a retinol. All 3 of the categories that I mentioned, I go over in the tutorial. They all work well. It's about getting the right dose for your skin. And in the tutorial, I give you a bunch of tips to figure out what is the best dose for you. Number 2 might surprise some people, but it's inexpensive. It's something you can do at home, and it's hyaluronic acid serum. Now, the serum should have multiple size molecules, particularly some smaller molecules, because that's what's going to help penetrate. In mine, I also put some peptides and I put vitamin C. Vitamin C is a key skincare ingredient. These should not break the bank. I think mine's like, for instance, is 2 ounces. So you're getting a lot of product. They should last you a while. You need moisture. When you use a hyaluronic acid serum, it helps immediately plump. It's an antioxidant and it helps avoid those lines from becoming etched in the skin through those aforementioned properties that I talked about. But you need moisture because hyaluronic acid attracts water. You got to drink water and preferably be around a moist environment. That's not always possible. So having water and moisturizer on your skin is important for hyaluronic acid serums to work, but they're key, inexpensive, and accessible. The third one, less accessible to people, But it's often, you guys talk about it on the channel, you ask me a lot, high frequency ultrasound, radio frequency, or fractionated RF. All of those three, done by a great provider with the right settings, are wonderful treatments to help build collagen, prevent further sag and lines, and they're not going to make you look unusual. Now, people are going to ask about fat loss, especially from high frequency ultrasound, radio frequency RF. Watch the video on my personal RF microneedling. I address that fact where you want to remove fat here, you want to remove fat here, but you don't want to remove the fat under the eyes or in the forehead. That's called precious fat. You need that fat to look young. So it's all about the provider and having a device that's real, meaning predictable energy levels, and the energy has to go to the right depth for the right duration in the right amount, or it can cause problems. But that being aside, with a good provider, very preventive, no injections, looks natural, and you can do one every year to 2 just to maintain. I did a complete video on the Viora fractionated RF that I like to use because I can address the surface of the skin, but I can also go deeper to add collagen to the deeper layers, and it just makes people look much younger. And I titled that video, No Fillers, No Botox, No Problem. You can watch that complete video. But those are 2 topicals and then a non-injectable option. And aging, when are people going to see the first signs of aging? It certainly could be in the 20s, it could be in the 30s. By 40 to 50, most people, unless you've been hiding away without sun exposure and you have the best genes in the world, by 40 you're seeing more advanced facial aging because structurally the bone, the skin, the fat has all changed already. So just be mindful. People come in with vertical lip lines, late stage. More than 3 or 4 crow's feet around the eyes etched in, late stage. Sagging, jowls, that's late stage. What I'm talking about in this video is early signs of aging. So I hope that helps. I put a complete playlist up here of things you can do at home to keep your skin and body beautiful, healthy, and vibrant.